At Ekvira Neuro, we focus first on understanding the problems that the patient is facing. We try to understand the duration of the symptoms, the kind of symptoms, the pain, the location, reduction in their motion. We have a complete understanding of exactly what they're dealing with, and then we proceed with a detailed examination. The examination includes assessing their strength, the sensations, the reflexes, even their gait or walk. Based on that, then we order imaging, which could include MRI of the brain and spine, CT scan of the spine, EMG, or even X-rays. Then we come up with a diagnosis which helps us treat them better. So there are two aspects of managing a spine problem: conservative and surgical. To me, conservative management includes medications, physical therapy, injections, and chiropractic therapy. Together, these are called as conservative management. They could range from a few days to a few weeks. If these fail, then surgical options are entertained. But to me, a patient always deserves a conservative approach first. Typically at Ekvira Neuro, we are more conservative. We try to focus on conservative management of spine problems, which means order physical therapy, medications, injections to help and try to alleviate the symptoms or pain that the patient has. If these fail after a repeated effort or after a consistent effort, then we try and come up with surgical solutions that best fit the patient. With respect to the surgical approach, the factors that depend on where the problem or the pathology exists. If the pathology exists in the front of the spine, typically approaches from the front are expected and used. If the problem extends behind the spine, then a posterior approach is what we typically focus on. Sometimes a hybrid, which is a front and a back approach, is in need, and that's what needs to be done. Spine surgery today is much safer than it used to be. In the old times, spine surgery would involve open surgical techniques primarily. Don't get me wrong, that still at times is needed. But today we focus on minimally invasive techniques, including tubular surgery, endoscopic surgery, even robotic surgery for the spine, which makes it much safer with less operative time and less days in the hospital. I feel spine surgery is much safer now. The latest tools and resources available to us in India include tubular surgery, endoscopic spine surgery, microscopic spine surgery, and even robotic spine surgery. All of these put together completely make the surgery much safer. And yes, they are available at the big centers in India, helping our patients just like all across the globe. I think the patient needs to know that the healing begins after the surgery. It is the most important aspect of the recovery that we as surgeons and a patient should focus on. Recovery begins after surgery, including critical care, rehabilitation, and even nutrition. All of these factors put together make for a best outcome possible for the patient.